I'm speaking to you today about my book, Strong Hearts and Healing Hands, that the University of Arizona Press published in 2021. It is a book about the intersection of Western medicine coming among the tribes of Southern California, but only those tribes living within the Mission Indian Agency. There were a number of Native Americans who lived along the coast of California, but they were excluded from the Mission Indian Agency and excluded from any relationship with the United States because settlers wanted to steal their land, and this would make it much easier, and has been much easier, that most of the tribes along the coast, except for one group of Chumash, are not recognized by the United States. So the Indian Service in the early 20th century started providing medical care on a limited basis to the 29 reservations and 7 Native American tribes here in Southern California. So my book deals with the beginning of this relationship, this medical relationship, but especially highlights the field nurses who came here in 1928, from 1928 to 48. As a group of white women who were professional nurses, public health nurses. So the field nurses worked hand in hand with the tribes, with the leadership of the tribal people, as well as individuals on a very personal level. They created trust relationships with one another. And as a result of this, they formed a partnership to fight infectious diseases among the tribes. It was devastating the people at the time. And of course, the big killer was tuberculosis. And so unlike what we've seen in the United States with the division of people over the pandemic, there was a coming together gradually of Native people and doctors, nurses, and the Saboba Indian Hospital to fight diseases over time. So although it's a tragic story of deaths and suffering from diseases, it's also a positive story about people working together and coming to grips with the various diseases and defeating them. The death records show that there was a tremendous decline in the 1930s and especially in the 1940s to infectious diseases, including tuberculosis, which was endemic here, and there was no streptomycin to fight it. So this is a story that's both a Native story and a story of Western medicine healthcare providers. And without the tribal people agreeing to help out, there would have been no relationship at all, and this would not have worked.